It starts with a yellow tinge in your eyes, on your skin, maybe even in your urine. You feel a little tired, maybe nauseous, and then someone asks, "Are you okay? You look kind of yellow." That's the first sign of something your body's been trying to tell you. You might have jaundice, but what is jaundice really? Why does your body turn yellow? And is it dangerous? Jaundice isn't a disease itself. It's a symptom, a visual clue that something deeper is going on inside your body. It happens when there's a buildup of a yellowish pigment in your blood called bilirubin. Bilirubin is a waste product. It's what's left over when red blood cells break down. Normally, your liver filters out this bilirubin, mixes it into bile, and sends it into your digestive system so it can leave the body through stool. But when something interrupts that process, when your liver can't process the bilirubin fast enough, or the bile can't drain properly, the yellow pigment builds up in your blood and begins to show on your skin, your eyes, and even in your fluids. That's jaundice. Of course, the yellow skin and eyes are the most obvious signs, but there's more happening inside the body. Dark-colored urine, like cola or tea, pale or clay-colored stools, itchy skin, fatigue, loss of appetite, nausea, abdominal discomfort, especially near the upper right side of the belly, and in some cases, unexplained weight loss. Now, not all jaundice is the same. Doctors usually classify it based on where the problem starts. The first is when the issue happens before the liver. This usually happens when too many red blood cells are breaking down too fast. The liver becomes overwhelmed with too much bilirubin and can't clear it quickly enough. This is often seen in conditions like malaria, sickle cell disease, or certain types of anemia. The second type happens inside the liver. In this case, the liver is damaged or inflamed, and it can't properly process or excrete bilirubin. This is often caused by viral hepatitis, like hepatitis A, B, or C, or by alcohol abuse, certain medications, liver cancer, or even genetic liver disorders. In this case, jaundice is a direct sign that the liver itself isn't functioning properly. And the third happens after the liver, when something is blocking the flow of bile. This is sometimes called obstructive jaundice. When bile can't drain out of the liver into the intestine, it builds up and leaks into the bloodstream. This can happen because of gallstones, bile duct tumors, pancreatic cancer, or scarring in the bile ducts. And this type of jaundice often requires surgery or procedures to clear the blockage. In babies, jaundice is extremely common and usually harmless. Their livers are still developing and can't process bilirubin as efficiently. It usually shows up a day or two after birth and goes away on its own. But in rare cases, if the bilirubin level gets too high, it can lead to serious complications like kernicterus, a type of brain damage. That's why doctors monitor newborns closely in the first few days of life. In adults, jaundice can signal many different things, from temporary infections to serious chronic liver diseases. That's why getting the right diagnosis is so important. If someone shows signs of jaundice, doctors usually start with a physical exam, looking at the eyes, skin, and general health. Then they move to tests, starting with liver function tests, which measure how well the liver is handling enzymes and bilirubin. Blood tests like the complete blood count may show signs of infection or anemia. Imaging scans like ultrasound or CT help reveal gallstones, tumors, or liver abnormalities. And sometimes a liver biopsy is needed, where a tiny piece of the liver is examined under a microscope. Once the cause is found, treatment depends entirely on what's going on underneath. If it's a viral hepatitis infection, the body might clear it on its own, or the patient might need antiviral medications. If it's alcohol-related liver damage, stopping alcohol is absolutely critical. If gallstones or tumors are causing a blockage, surgery may be needed to remove them. In cases of autoimmune liver diseases, doctors may prescribe steroids or immune-suppressing drugs. And in end-stage liver failure, a liver transplant might be the only way forward. In newborns, treatment might include phototherapy, placing the baby under blue light, which helps break down bilirubin in the skin, or in very rare cases, a blood exchange transfusion. There are ways to prevent jaundice too. Vaccination is key, especially against hepatitis A and B. Practicing safe hygiene, avoiding contaminated food and water, and staying away from alcohol can reduce liver stress. Don't share needles, razors, or toothbrushes. And be cautious with medications, especially painkillers and herbal supplements, which can affect liver health when overused. Your diet matters too. Maintaining a healthy weight, eating clean, balanced meals, avoiding highly processed foods, all of this supports liver health and reduces the risk of jaundice later in life. The outlook depends on the cause. If jaundice is caused by something temporary, like a mild infection or medication reaction, it often resolves completely once the root issue is treated. But if it's caused by chronic liver disease or a blockage, the damage can be long-term. Earlier the diagnosis, the better the chance of recovery, and that's really the bottom line. Jaundice is never something to ignore. Yellow eyes or skin are your body's warning sign that something inside needs attention. It may not be painful at first, you might feel normal, but jaundice is like a flashing light on your car's dashboard. If If you don't look into it now, it could lead to serious problems down the road. But the good news is that with early detection, medical care, and some smart lifestyle changes, most cases of jaundice can be treated and even prevented. Don't ignore the signs, get checked, protect your liver, and take care of the one organ that quietly does over 500 essential jobs for you every single day. You might not think about your liver often, but trust me, when something goes wrong with it, you'll feel it everywhere. Listen to your body, take action early, and give your liver the care it deserves.